pioneering robot developed in the United States to rehabilitate stroke victims has been helping patients in our region. North Tyneside General Hospital is the first NHS site in the UK to use the machine as part of clinical trials. Now hundreds of people across the UK could benefit from this intelligent form of treatment, as Alison Freeman reports.
It might look more like a computer game than medical treatment, but this robot is used to rehabilitate stroke victims. It's helped Leslie Rogers overcome the frustration of not being able to use her right arm anywhere near as well as she could before her stroke 2 years ago. She's been part of a clinical trial at North Tyneside General Hospital.
It has been positive because I was active before this anyway, and since I took the stroke, everything went downhill. But with being at the robot, at least it's given us the more movement than what I had when it first happened.
North Tyneside was the first NHS hospital in the UK to use the robots. They exercise the patient's arms by getting them to move between targets on the computer screen. The clever thing about the robot is it can sense how much movement the patient has. It then adjusts how much assistance it gives. This teaches the brain and the arm to work together again.
There's one of the machines, I'll turn left and right, and I was about that far from the middle. By the end, I was only that far, and that's how much it does for you. I felt over the moon.
The kit has already been tested in North America, where it's been found to have amazing results. The trial in the UK is being led by a medical team from Newcastle University.
It looks as if people can regain better function of their arm with robot-assisted rehabilitation, but it is a relatively small study and we need to see if we can duplicate these results in the UK. And if we can, then hopefully this would mean that robot-assisted rehabilitation could in the future become part of usual care, and that's really exciting.
We are organizing the largest study ever in the world on rehabilitation robotics that would also test the technology and also the potential savings. It's also very exciting because it gives us the potential to see the whole spectrum from the original academic development more than 20 years ago all the way to actually the deployment and actually making a difference in people's life.
Well, Alison joins me now. Alison, how many people will this robot actually help?
Well, the clinical trial is set to last for 5 years, and during that time, just over 700 people should get to try it out. Only 200 have signed up so far, but Dr. Helen Rogers, who we heard from there, said she's keen to hear from anybody across the country who thinks it might benefit them. Now, the study is going to cost £3 million, but it should save the UK far much more money than that if it's as successful as it has been in the US. That is because when people's mobility is better, they're able to do tasks themselves, look after themselves, and that means less money being spent on long-term care.
OK, Alison, thank you.